So PCUT is a new company that a lot of people are excited about, and we're going to do a little tour of their website. This is their homepage, Partnership for Compassionate Use Therapies, and it was put together with the help of some very good volunteer web design people. And it just shows some of the things that PCUT is, with little highlights here. Some important takeaways are that it's a nonprofit drug production company, and they're very focused on the distinction between near-term effective treatments and long-term future cures. The other thing that's important to know is that when we talk about near-term effective treatment, the focus is on science that already exists. PCUT does not try to reinvent the wheel. It recognizes that when we talk about novel treatments, we're waiting 8 to 12 years before we even get new science into clinical trial, which is far too long for the patients that need this type of therapy. And then we mentioned the benefits for the general social good of bridging the gap between new innovative science and the people in the society who can benefit from it. Let's just take a look at some of the drop downs. We have a little area about the group, what its mission is, the programs, the people, partners, and its current tax deduction eligibility. Let's look at the people here. And the people are volunteer professionals from various industries. That's all we need to talk about with them. The mission, as we said, it's a nonprofit drug production company, focuses on treatments for rare, life-threatening disorders for which there are no other effective therapies. And the important part is that PCUT tries to get the drug off the shelves and use an innovative business model to make these drugs commercially viable for manufacture. How do we do that? Let's look at nonprofit drug production. Here we have a basic overview of the model of the components of production, all contributing toward the central joint venture that PCUT as one company is organizing. We have a new drug, or we should say an existing drug with a new partner, and we get the intellectual property and drug and CMC transfer, comes to PCUT, and then solicit all of the partners to contribute the components of production. Ultimately, it ends up going through clinical trial, gets approved by the FDA, and then there's economics sharing, which go back to each individual participant of the project. So it's a win-win for everyone. You can read a little bit about the focus. Currently, the first project is for an ALS therapy, trade name iPlex. And if we want some background, we can look in the library. There's useful publications. All of these are linkable. You can drop down, see some publications. We can also look at different documents. And these have various categories of information, like the 5 clinical trials of macasmin and rinfavate that show safety and positive pharmacokinetics in humans. So that's just about it for now. There's ways to get involved. We'd like you to check this out and give us a call and join the cause. Thank you.